Good afternoon. I'm Mayor Lyrian Gaylor-Baird, and welcome to this community briefing on Lincoln and Lancaster County's pandemic response efforts. We appreciate you tuning in to learn more about how to protect yourself, your loved ones, and our entire community. And we appreciate you, Margie Prop, for providing interpretation for this event. Each night, when I sit at my desk and click open my email from Raju Karkalapudi, our local health team's, our lead epidemiologists, this email he sends contains the daily situational report, a snapshot of how our community is faring in the pandemic. And in the report's blue and orange charts, I see reasons to feel proud and grateful to live in Lincoln. With each flattening of the curve, I feel pride in the way the people of Lincoln have stepped up time and time again to protect our local healthcare system and to help our community avoid the surge of cases and deaths that places like Arizona and LA County are experiencing right now. That said, if there's anything we've learned in this prolonged pandemic, it's that we cannot rest on our laurels. And today, we do need to alert you to some changes in local conditions that are concerning and that keep our risk dial in the red. Health Director Pat Lopez will share more details later in the briefing, but the gist is this. We are seeing a reversal of some of the progress that we made before Thanksgiving. We are seeing rising daily case counts, rising 7-day rolling averages in our cases, and increasing hospitalizations. So the pressing question on our health team's minds is this: are these momentary blips in the data or the start of something worse? Because we know that COVID blips can turn into COVID surges like we are witnessing in other parts of the country, I want to remind everyone how important it is to stay strong, to stay smart, and to stay safe. None of us want Lancaster County to look like LA County, not even close. You have shown throughout this pandemic how important it is to you to take care of one another. And as hard as it is to remain at arm's length from those we care about, think about how heartbreaking it would be to lose someone you love or to watch a friend or a family member deal with potentially lifelong impacts of this disease when we are so close to putting a vaccine into their arms. Please continue to be vigilant about protecting yourself, your loved ones, and our community. Wear your masks, wash your hands, and watch your distance, continuing to avoid crowded places, confined spaces, and close contact. We will not be doing this forever, but it's vital that we do so right now. These are our best defenses until more people are vaccinated. And we are pleased that so many in Lincoln and Lancaster County are eager to take the COVID vaccine. Our health department and community partners will continue to administer doses as quickly as they receive them. And as of Monday, Lincoln had received 10,300 doses. 8,300 people have received first doses, and 1,500 are scheduled to receive vaccine this week and next. Our hospitals began giving second doses last week. Vaccines are one of public health's greatest achievements. Vaccines not only protect those who receive them, but they also protect entire communities by preventing and reducing the spread of disease. As we continue our COVID-19 vaccination efforts, it's really helpful to have a general understanding of the vaccine, how it works, and its benefits. And joining us today is Dr. Stephen Rademacher, who specializes in infectious disease. He's here to simplify the science and share some key fundamentals related to the COVID-19 vaccine. Over to you, Dr. Rademacher, and thanks for being here.
Thanks for having me speak. And we're just going to talk about the 2 vaccines that are currently available to healthcare workers and residents of long-term care facilities, and hopefully they'll be available to a lot of others again soon. The 2 that are currently available are messenger RNA vaccines. So they're vaccines that elicit a immune response to the spike protein and thus provide the protection in that way. They're 95% protective 1 week after the second dose. The Pfizer vaccine is, after the first dose, is 52% protective after 2 weeks. And they're thought to be pretty equal in regards to how well they protect one. The vaccines are given in the muscle. The Pfizer vaccine is given 3 weeks apart, the 2 doses, and the Moderna vaccine is given 2 doses 4 weeks apart. So either one is there. Either one that you get would be a good thing to have occur, and you don't want to mix the vaccines. You want to have just use the same vaccine. If you the first shot's with the Pfizer, the second one should be with the Pfizer, and same with the Moderna vaccine. I really think that vaccines are one of the ways that we potentially can get out of this pandemic. And when cases are down because of the vaccination and a lot of people agreeing to have that done, then hopefully we'll get to the point where we're not wearing masks and we're not having to socially distance anymore and kind of get back to normal. But I think it's really one of the ways that we potentially can get out of this pandemic. I've had my 2-shot series. I tolerated it well. I had some mild soreness if I touched my arm, but otherwise it didn't bother me at all. You can get fever, chills, headaches, muscle aches, diarrhea, fatigue. And with the vaccine series, they say that you're more apt to have an allergic reaction, or not allergic reaction, but a side effect with the second dose than the first. There have been some rare cases of anaphylaxis. I think it numbers in the 20s, and so that it's a very small number. And so one of the things that's done is some observation after the vaccine. It's supposed to be at least 15 minutes for most people, and 30 minutes if you have a history of anaphylaxis to things such as immunizations. Let me see what else I can think about. I'm not sure about Lancaster County. I need to check the site, but some of the outside of Lincoln and Omaha in western Nebraska, because they have less healthcare workers and people in long-term care facilities, they're starting to look to vaccine others. I think the next group is to be 75 and older. And Health and Human Services said that they were going to have a site where you potentially could register to becoming, so that you're notified when the vaccine's available to you. I know my parents are from Buffalo County, and they registered in Buffalo County. Their health department had a site that was up, so I registered them last week. And but I know that Health and Human Services is supposed to have a site up either this week or next week that you potentially could look to sign up for the vaccines.
Well, thank you, Dr. Rademacher. We appreciate you being here with us today. And I know many people are eager to learn more about how they can become eligible and access the vaccine. And we will continue to share information about how much vaccine the state has allocated to our local community and how it will be distributed as soon as we have that information available. So thank you for your patience. And please know that we are as excited as you are to turn vaccines into vaccinations. Next up, we will turn to Health Director Pat Lopez, who will share more information about the vaccine and local conditions in Lincoln and Lancaster County.
Thank you, Mayor. Since vaccine supply is still limited, vaccinations are continuing to be given in phases. And the federal government and the state provide recommendations on who should be offered vaccine and when. The vaccine is not yet available to the general public in our community. There are a lot of moving parts and some uncertainties, but we are making progress on our COVID-19 vaccination efforts here in our community and across the state, as Dr. Rademacher said. There are more people taking advantage of the opportunity to receive vaccine as soon as it is available to them. Across the state, many places are not taking the vaccine in the communities. Like Dr. Rademacher said, they may have fewer healthcare providers, they may have fewer people desiring to take the vaccine, so therefore they are moving further into other phases. As the mayor said, we've received 10,300 doses of vaccine locally. As of Monday, the Lincoln-Lancaster County Health Department and our partners, Bryan Health, CHI St. Elizabeth, Lincoln Surgical Hospital, and Blue Stem Health have administered 8,300 first doses of COVID-19 vaccine. An additional 1,500 people are scheduled to receive vaccine this week and next week. You'll now be able to join us in tracking our vaccination progress with the new information added to our COVID-19 dashboard at covid19.lincoln.ne.gov. You will first see the number of vaccines administered by the week, and then if you click on the cumulative tab, you will see the total number of vaccines administered over time. If you hover over January 9th, you'll notice the number for cumulative doses administered is currently 12,200. The number on the dashboard and the number I just provided are different. That's because the dashboard number also includes some long-term care facility data coming in from the state system and other vaccines that are not administered by the health department. Bryan Health, CHI St. Elizabeth, Lincoln Surgical Hospital, or Blue Stem Health, in addition to Nebraska Heart. The other addition to the dashboard is a new tab under the map on the left side. By clicking on the Vaccines tab, you will find the number of vaccines given by zip code, along with the information that was previously available with the number of tests and the number of cases by zip code. Vaccinations are continuing to be given to those in Phase 1A. Starting this week, vaccine is now available for home health and hospice providers towards the end of this week or early next week. Hospitals can continue to vaccinate primary health care personnel, and the last round of first doses is scheduled for next week. The vaccination of residents and staff at long-term care facilities is moving ahead. Most of the long-term care facilities are part of a federal program that partners them with a primary pharmacy partner, and they coordinate the on-site efforts. Some of these facilities have finished vaccinations. As we monitor the last, mentioned at the last briefing, the health department was assisting with vaccinations at 2 long-term health care facilities that did not have a pharmacy partner. The first round of vaccinations for those residents and staff at those facilities is now complete. As more people receive their first dose of this safe and effective vaccine, many are receiving their second dose, including healthcare personnel and emergency medical technicians. We want to stress that individuals need 2 doses to build a high level of immunity. When you hear that the Pfizer is 95% effective and Moderna vaccine is 94% effective in preventing COVID-19, these levels of effectiveness are based on 2 doses, as Dr. Rademacher said. When it is your turn to receive your first dose of vaccine, you will receive a vaccination card that will include information on when you need to return for your second dose of the vaccine. You will need to take that card with you when you receive your second dose. The next vaccination phase after 1A is 1B. This area includes people aged 65 and older and other essential workers. We want to be ready to begin vaccinating those in Phase 1B as soon as the supply is available, so we are actively working on that portion of our plan. We continue to meet with our many community partners who will be supporting the vaccination effort, and we will have more specifics to share in the near future. The amount of vaccine we have available is dependent on supply, and there is a process for how that's allocated. Allocation numbers are given to the state by the federal team about 1 week before vaccine arrives. Once the state receives the allocations from the federal government, it starts to allocate vaccine within Nebraska. Allocations go directly to the healthcare systems, local health departments, and the select pharmacies. There is not a central location in Nebraska that receives all vaccine. Once the health department receives the shipment, we go to our vaccination list and are prepared to contact those next in line. And we work to get those doses into arms as soon as possible. Until vaccine is available for the general public, we continue to ask for your understanding and patience. When there is enough supply to start public clinics, we will make an announcement. In the meantime, we continue to provide updates during the week, these weekly briefings, and through other channels. You will also find the latest vaccine information at covid19.lincoln.ne.gov and through the COVID-19 hotline at 402-441-8006. And please keep protecting yourself, your loved ones, and the community by wearing masks, watching your distance, washing your hands, and avoiding crowded places, close contact, and confined spaces. After seeing some improvement in our data indicators the last half of December, they are now leveling out or heading in the wrong direction, as the mayor mentioned. The weekly positivity rate remains extremely high, so even with lower testing numbers, we are seeing an increase in new cases. The number of individuals with COVID-19 who are hospitalized is also increasing. With the COVID-19 risk dial remaining in red, we are extending our directed health measure for 2 more weeks. It is now in effect through January 29th. The weekly number of new cases has increased from 926 the week ending December 26th to about 1,200 the last 2 weeks. So far this week, we have 362 new cases reported. And then looking at our 7-day rolling average, the 7-day rolling average chart from December 20th to January 9th shows the decline in cases in late December. The average has increased from about 130 to 168 at the end of last week. And as we look at testing, it is readily available locally and remains a very valuable tool in preventing the spread of the virus. The arrival of the COVID vaccine will not remove the need for testing anytime soon. We need to maintain vigilance and keep up our guard. Those with COVID-19 symptoms must stay home, stay isolated from others, and make plans to get tested. We can prevent further spread by identifying new cases and reducing close contacts. Testing turnaround time is very good, and in most cases, you can expect your results within 24 hours. And you know, we also look at our positivity rate. The high weekly positivity rate has remained an area of concern for several weeks. The rate was over 33% the week ending January 2nd and was down only slightly to near 29% this past week ending January 9th. This is a key indicator that the virus is still well established in our community and we must maintain precautions. The number of COVID-19 patients in our local hospitals was less than 100 in late December and early January. Today we have 103 COVID-19 patients hospitalized locally. 69 of those patients are from Lancaster County and 34 from other communities. Unfortunately, we continue to lose many members of our community to COVID-19. Today we are reporting 4 more COVID-19 deaths, bringing our total number to 175. 96 of those deaths were in December and January, which is 55% of the total deaths occurring in just the last 6 weeks. Remember, the red level on our COVID risk dial signifies a severe level of COVID-19 in Lincoln and Lancaster County, meaning broad community spread still exists. To prevent further spread, please limit your contact with those outside of your household as much as possible. older adults, those with underlying health conditions, and others who are at risk for illness must be especially careful. Stay home, rely on help from family or friends for needs outside the home, and distance yourself from household members who may work outside of the home. Visit businesses and participate in activities that follow public health guidance. Visit recoverlink.com for information on how local businesses are taking precautions to protect employees and customers. Be diligent in following the 3 W's. Wear a mask, watch your distance, and wash your hands. And be informed and intentional and thoughtful in informing and avoiding the 3 C's. Crowded places, confined spaces, and close contact. We have the power to bring our numbers down. Our individual and collective actions will impact the spread of the virus and the number of cases and hospitalizations we will see in the next few weeks.
Thank you, Director Lopez, for reminding everyone that we have power over this virus and that we all do need to remain diligent. We know that our actions matter not only to ourselves, they have an impact on those around us and those whom we love. And with that in mind, thank you again to all our businesses who are working with our health professionals to keep their employees and customers safe. The precautions we are taking provide a path toward a faster and more sustainable recovery for all of us, and that includes our favorite retailers, restaurants, and bars. Our businesses did get some good news late last week about exciting new opportunities available now as provisions of the federal COVID-19 relief bill go into effect. And here are some of the highlights. First, the Paycheck Protection Program reopens this week, and I encourage businesses to act quickly to access support. This program offers low-interest loans for small businesses that will be forgiven if businesses use the funds for eligible purposes. Improvements have been made to the program, including expansion to additional organizations, second loans for eligible businesses, and expanded eligibility for the loans. And second, there are more resources now available for economic injury disaster loans and small business lending and debt relief. Lincoln businesses can learn more on the Small Business Administration website at sba.gov. And third, the tax credits for employers covering sick leave and family leave and the Employee Retention Tax Credit have been extended. More information is available at irs.gov. I really want to urge our local business owners to take advantage of these resources quickly and to learn more on the business resources page at our local covid19.lincoln.ne.gov website. Director Lopez also mentioned the new Recover LNK website, where you can find information on how local businesses are taking precautions to protect employees and customers. That site is recoverlnk.com, and it has wonderful information. I hope you will check it out. And at this time, I just want to thank everyone for joining us and see if there are any questions.
Mayor Riley Johnson with the Journal-Star.
Hi, Riley.
Hi, what will be the key metrics in the next 2 weeks as the health department evaluates what to do with the DHM? And is it going to be watching the hospitalization level primarily?
Well, Riley, we do monitor hospitalizations, and we are concerned about the uptick. Almost a little over 23% of our hospital beds are currently occupied by COVID patients, and we want to see that number come down for sure. I'll let Director Lopez, she'll come up and talk more again about those key indicators that will be informing any change in our status, both on the dial and corresponding in our directed health measures.
Good afternoon, Riley. I think I said before that we monitor several indicators, not just hospitalizations. That is one key factor. But another one is looking at our number of cases that we have per week. We talked about that 7-day rolling average. And as we've spoken before, as our case numbers increase, you're going to start seeing an equal increase in hospitalization. So yes, we do look at hospitalization, but we're looking at our increased casing load, caseload. We're looking at our positivity rate. We're looking at testing availability, which is great. So if we start really talking about this, we really need to see an improvement in our positivity rate and a decrease in our cases and an improvement in our testing. Even though it's widely available, we see fewer people going in for testing. So those are really the key metrics that we're looking at. We're able to do a response and contact tracing within 24 hours of receiving a positive case. So that's a really important factor that we also look at.
And Pat, is there any change? I know you're extending the current DHM. Are there any tweaks to it as it stands right now?
No, they're not. We were really hoping that we would see a change, but that's just not what's happening with our case numbers. But I know that we will. We're very close. We just need to be diligent and persistent in really wearing our mask, washing our hands, and watching our distance. And we will get there with the new vaccine. And I'd like to see us get there even sooner. And if we are able to make changes, we will make changes as soon as we can.
Director Lopez, this is Bill with 1011. I had a question about phase 1B, and I noticed that the age range is now 65 plus rather than 75 plus. Is that a change, a result of the federal guidance recently issued?
Yes, I heard there's been discussion about that going on. Bill, thank you for bringing that up. We haven't had a confirmation that that's been announced by our governor yet, but I anticipate that guidance will be followed. And just to share with you, in preparation, we actually have launched a survey to our physicians' offices in Lincoln, and they are assisting us. We've had many conversations in identifying the number of patients they are seeing 75 and older, those who are in that other range of the 64 to 75, and those under that based on specific age groupings and individuals with underlying health conditions. So we have a very strident plan in place, and we plan to be ready as soon as we have vaccine available. We're also working, we'll update you next week on some of the other work we're doing in preparation for administering vaccine outside of 1A. Next week will be, I've asked for doses enough to cover all our home health and hospice care providers. We're finishing inpatient behavioral health clients this week, and then we'll keep moving down the list. But we hope to be vaccinating dentists, home health providers, and hospice workers, as well as school nurses. If we get a vaccine allocation, we're ready.
Everybody wants to talk about that timeline. Do you think we could be in 1B by the end of the month?
I think that'd be a little optimistic, but hopefully not too far after that. And we're being ready to be there, Bill. So as soon as we get vaccine, we have plans in place. And I should tell you, both of our hospitals and health systems, as well as our physicians in the community, schools, higher education, are all reaching out to assist. So we know we're going to be able in our community to respond and do a great job of getting that vaccine out there.
Thank you so much, Pat.
Director, this is Brent with Channel 8. Is there any concern with UNL students headed back to campus that there might be kind of a surge in caseloads?
Well, Brent, we'd always be concerned when, it's like a small city moving into our community. But as we've said before, we work really closely with the university. They put in additional testing strategies that are starting when students do return to campus. And we'll be able to give you an update, but we're continuing to monitor closely. We have all systems in place to quickly identify positive cases and isolate them, control any outbreaks that are occurring. And it's not just UNL, it's with Wesleyan as well in Union College, and we have the same process in place with Southeast Community College.
Director Lopez, Riley with the Journal Star. Follow-up question to that. UNL is planning to do some regular testing of its students and its community. How will that sort of regular sort of testing affect your key metric of positivity rate? I mean, it stands to reason that if there's more people being tested, many of them won't have the virus. Are you expecting the virus positivity rate to come down in the community overall, or will reporting requirements be separated?
We still monitor their positivity rate separate to see what the spread is within on campus. But we look at overall what's happening in the community, Riley. We definitely know if we have a higher positivity rate in just those students that we're seeing, they're out in our community, they're part of our community, so it definitely can impact the community. But with the new testing measures in place, we're planning to mitigate that, and we'll adjust those testing measures as the process goes on with them as we learn more and see what the results are.
Are there any other questions?
Mayor Riley with the Journal Star. Just to follow up with you, yesterday the city council sort of tabled any sort of discussion on ending the emergency declaration. And what did you make of that move by the council?
I think they made their intentions clear during their discussion. I think what they recognize is what we know to be true, is that the nature of the emergency authorization is to allow us to access really vital resources that help us manage the pandemic and support our community. I think the majority of the council members recognize how important that is. Was I expecting the vote to go the way it did last night? I was not expecting them to table it, but I appreciate the understanding that some of the concerns that the sponsor of the legislation had were not at all addressed by the resolution he put forward. So it's good to have that clarity, and it's good to move forward and continue, I hope, to work together. We are all in this together, and we need to ensure that we have that we are maximizing the resources we have in order to effectively prevent the spread of illness, to prevent suffering, to protect life, and to get us on the road to economic recovery and senses of normality that we all are craving. And working together, we will get there.
This is Brent. The FBI has warned about the possibility of armed protests in all 50 state capitals in the coming days. Of course, that includes Lincoln. Do you have any concerns about protests here, and what assurances can you give to residents, about that they'll be safe?
Well, I would first say that our Lincoln Police Department is aware of the concerns. They're monitoring, they're doing threat assessment, and they're reaching out to other partners in law enforcement so that there is good dialogue happening about what, and better, more eyes on the street, so to speak. And so they will ensure that we have an appropriate response should it be necessary. And I really have a lot of confidence and faith in our Lincoln Police Department and their ability to manage any unexpected events, and their commitment to protecting free speech and preventing violence. Are there any other questions this afternoon? Well, with that then, thank you again for joining us, to learning more about how to protect yourself, your loved ones, and our entire community. We'll be back again next week with more on our local conditions and pandemic response efforts. Thank you for being such an important part of that effort.